Good afternoon. I am Dr. Julie Botticello. I am Senior Lecturer in Public Health at the University of East London. And I am here to talk to you today about community participation in public health. So we are in the midst still of a global pandemic and a lockdown within the UK, hence my broadcast today coming to you from my bedroom. I wanted to talk to you about a really important subject, which is around community participation in public health. Right now, in the midst of this pandemic, in the midst of COVID-19, we have experienced community involvement through sort of reaching out to people that we know, our friends and our families and our neighbours, sort of connecting, checking in, touching base, making sure everyone's okay, or meeting their needs if they need extra help. And we're also reaching out even to people that we don't know, sort of delivering shopping, making phone calls, sort of like meeting new people in spite of this crisis. And it really goes to show the resilience that communities have and the resources that communities have to look after one another. And so today I really want to talk about these community resources working really directly with public health and with clinical medicine toward more effective practice, as we are actually experiencing already with the COVID-19 crisis. You may be familiar with Dr. Tedros, who is the director of the WHO, the World Health Organization currently, and he advocates for collaboration. He has spoken very recently around nations needing to collaborate, to work together, to put aside politics, to put aside ideology, and really collaborate, bringing their individual strengths and expertise to the table to overcome COVID-19, to find a vaccination, to work strategically around public health directives to limit the spread, reduce the spread, and really begin to contain and control this virus. Previously, Dr. Tedros was Minister for Health in Ethiopia, and at that time, he also was very much an advocate for collaboration and cooperation. And at that time, he developed quite strong sort of community outreach programs where members of communities were trained to work within their communities to deliver health messages, whereas the emphasis was on maintaining health, not some, as well as preventing disease, but the positive focus was really about how to be well, and a really sort of positive slant on being well and bringing that positive message to communities. That type of action that Dr. Tedros undertook in Ethiopia takes place across many nations across the globe, and here even in the UK. So a couple of years ago, I was involved in a project in East London, in Newham, where UEL is based, to do with tuberculosis. So tuberculosis is an ancient infectious disease. It is still present with us. There has not yet been cracked. It still circulates, and although prevalence can go down and incidence rates go down, there is still an existence of tuberculosis. It has not been eliminated or eradicated. You may have heard of TB, tuberculosis, and you may be most familiar with it when it's in its infectious state through the lungs. So like COVID-19, it is a respiratory infection. And when it's infectious and it spreads through water droplets coming through, being exposed to other people and their breathing. However, there is another form of TB, which is called latent TB, and that is when you've been exposed to TB, your immune system has been strong enough to suppress it from turning into active TB, but it remains in your body, sort of hidden away in your body, and that's called latent TB. And the TB may never ever manifest through the rest of your life, or at another point in your life, perhaps when your immune system is compromised or is under stress, then TB could re-emerge, most likely in other parts of your body, from your eye to your elbow, in all honesty. And you are not really a risk to other people, but you are definitely a risk to yourself, and you need treatment in order to be cured from the TB. And so a few years ago, I was involved in a project around TB in Newham, and I was working with Imperial College London, Public Health England, different health authorities who provide healthcare services in East London, and community-based organisations also across London. And we met to really talk about how can we work more effectively together, because each one is good at different things, but if we could bring our resources together, then we would make a really strong team, you know. And so we had several meetings, and we came to understand actually that we have many strengths and we can work together, and we really need to understand each of our different expertise. Oftentimes clinical medicine will understand its expertise, but there's a lack at times to understand the expertise that communities have and community-based organizations have. So really, our research revealed sort of 4 major points. This was capacity, collaboration, culture, and trust were the real 4 significant points arising from our research. In terms of capacity, community-based organizations have both the flexibility and the resources to meet the needs of their community. They can meet them at all hours, they can meet them at the weekends, they can meet them at evenings. Community-based organizations that will go into faith-based organizations, or actually a community-based organization could be also a faith-based organization, and they can deliver messages, and they can hear as well, you know, listen and hear to what communities need and what they are concerned about. Another aspect that we found obviously was collaboration. So this was working across sectors and really understanding that we're in partnership with one another, that we have different roles to play, we have different agendas that we work to, and that mutual respect for each of our separate expertise around what we bring to the table is vital for this collaborative working to go ahead. Another finding was around culture. So I said that really understanding the differences in different communities, understanding language. So it's not only, say, speaking local languages of nations or ethnic groups, so that they can really understand what the messages are being said, but also ensuring that you're speaking in a non-medical language, in an accessible language, where people have a chance to really understand what is being said, to process that information, to ask any questions, get some clarity, but also offer back their own insights and sort of speak back as well to the group, to the community worker, who then can also bring messages back to policy and to the wider group, so that we have a multi-way channel of communication. And finally, this really brings us to the last point around trust. So community-based organizations and their members are really operate in a sense of trust within their communities. They're from their communities, they've built relationships and rapport over much time, and that is a significant value that they bring. Whereas, say, a health worker may come in once in a while, or not as often as they see their regular community members, and that trust can really develop with the community-based organization and the community, and then the rapport can be brought back to the wider group of the collaborative project. And so we realized that that really, for things to progress, for diseases such as tuberculosis and perhaps also for COVID-19 to come under control, we really need to take a collaborative approach, working with clinical medicine, working with public health, working with community-based organizations, working with the academic sectors, so that we can collaboratively produce outcomes that are meaningful and work for all. So really, in short, that was my message for today about what community-based organizations and communities can do in collaborating with public health around promoting wellness, reducing the spread of diseases. If you're interested in knowing any more, like I said, I'm at the University of East London. I'm Dr. Julie Botticello. I'm a senior lecturer in public health, and I'd be very interested to talk further with you around your studies, whether this was at undergraduate, master's, or PhD. Thank you very much for your time, and I look forward to seeing you soon.